let's put 2 minutes on the clock, and our time starts now. Lisa Kellogg is 25 years old, presenting to general practice with complaints of a rash that started as a single pink patch on her trunk, followed by the appearance of small patches on her arms and legs. She reports that the rash is mildly itchy and has been present for the last 2 weeks. She denies any recent illnesses or exposures to new medications or substances. On examination, multiple oval-shaped, pink-coloured patches with fine scales are observed on her trunk, arms and legs. Her temperature is 37 degrees, blood pressure 120/80, heart rate is 82 and regular, respiratory rate is 16, and BMI is 23.5. The remainder of her examination is unremarkable, and a picture is shown. What is the most likely diagnosis? Provide one specific diagnosis. All right, and time is up. Now, let's have a look at the answers. And of course, this is pityriasis rosacea. We've got all of you getting this one absolutely correct. Very well done. And again, we are going wild on the gold star button tonight. Gold stars all around. Now, pardon me, this is a relatively common presentation for general practice. She's in that classic age group as well. And something to bear in mind on the exam day, that when we get to those questions that have the images associated with them, a lot of us all struggle with the printed version of the images. They're trying to mass produce these books. They're not always done on, shall we say, high fidelity, high resolution photo paper. And so it can be at times difficult to actually see what's in the image, which is why I would reinforce, don't be afraid to then ignore the image. If you're looking at it kind of going, what's going on? Everything you should need to know will be in the clinical stem. And pityriasis is one of those conditions where it's got that classic presentation of your herald patch that appears, followed then by your smaller oval patches across that classic distribution. And this is going to be pretty representative of the types of questions then you'll see in the actual exam. Without further ado, let's put another 2 minutes on the clock for part 2 of this question. Your time starts now. You give her the diagnosis and she states she's keen to do something to treat the itch, which she is finding annoying. What 4 management actions would you take? Doses are not required. All right, and time is up. Having a look then at some of our answers, we have apply moisturizer to dry skin, showering or bathing with plain water and bath oil or aqueous creams or soap substitutes, not using soap directly, which will dry out the skin further, avoiding sun exposure, a medium potency topical steroid cream or ointment, and I think you would have to specify, pardon me, a medium potency, so you'd be using more of your kind of mometasone type preparations, probably avoiding hydrocortisone as the low potency steroids, oral antihistamines, and look, your flavour of choice is fine. They all have fairly similar efficacy in this instance. There is some evidence for topical zinc oxide or calamine lotions to relieve itch. Now, for more severe cases, you can actually use a cyclovir, can lead to faster resolution of the lesions and help relieve the itching, but only in those severe cases, and so this case wouldn't qualify, and that this is from DermNet. That wouldn't also be aligned with PBS prescribing, so it would be a private script as well. And of course, for severe cases, you can also refer to dermatology for consideration of phototherapy as well. Again, wouldn't be really applicable to this case here. So seeing some fantastic answers through there, pretty much nailing it. Warm packs over lesions. I don't know if you would be getting much in the way of marks for that one, to be honest, but certainly from a comfort point of view, heat packs are always nice. Again, some fantastic answers coming through here. Again, I like that you've actually specified an example you would use, but I think I'd probably be looking for a more potent steroid than hydrocort in this instance. And look, something that's not on here, but you are exactly right, would be reassurance that it will self-resolve in a couple of months, because that is ultimately the management of pityriasis. Pardon me. Now, where that does become a little bit more risky is that this is asking for management steps to manage the itch, whereas I guess that's probably more of a reassurance that the itch will go away. You could put it perhaps a little bit risky, but I think given there are other options there, I probably would be looking elsewhere. Again, we've got avoid excessive sweating. Actually, yes, that's not on here, but that is a trigger for itching as well. And I think anyone marking this would accept UV protection with a good sunscreen as part of avoid sun exposure. And yes, very good. Cancelling that to 4 and changing to avoid soap-based wash products. Very well done. All right, let's get ready for... Oh, actually, I might pause here for a second. Deviate from the scheduled program a little bit, because there is something that you will see pop up time and time again, and exactly on questions like this, where they may say, if we were to go back to, say, the first section here, for this, instead of what is most likely diagnosis, they may actually specify, yes, they do love calamine lotion, I agree. They may actually specify what is your single management action. And that can feel like a bit of a trap of, oh my goodness, okay, I need to choose what is the most important thing. Often if you see that, you're looking at it and you're thinking, oh, this is a benign condition, the actual answer is essentially do nothing. It's reassure the patient that no intervention is required, or reassure is self-limiting and will resolve. Just something that I've picked up from looking at exam question after exam question after exam question, that is a common way they will phrase do nothing is what is the single most important management action. It may specify non-pharmacological as well, but just something to be aware of. All right, coming then through to part 3 of our last question. 2 minutes on the clock, your time starts now. Lisa's rash resolves and she returns 3 months later for her annual influenza immunisation. You confirm her identity. What questions would you ask before administering her immunisation? Provide 5 specific questions. right, and time is up. Let's get to the answers then. Now, this is one of those maniacal questions that I swear they must sometimes look at and say, ooh, ha, ha, ha. These are all the things that we should be doing, but perhaps some of us may not be doing it every single time. Now, this is taken exactly from the RACGP immunisation checklist. I'll make this full screen so it is a little bit more easier to read. And of course, these are, is she unwell today? Does she have any disease that lowers immunity? Is she having any treatment that lowers immunity? They would probably be grouped together as a single mark. Is she an infant of a mother who received highly immunosuppressive therapy? Has she had a severe reaction following any vaccine? Does she have any severe allergies to anything? They would probably be grouped together as well. Has she had any vaccine in the last month? Has she had an injection of immunoglobulin or received any blood products or a whole blood transfusion in the last year? Is she pregnant? Does she have a history of Guillain-Barré syndrome? Was she a preterm infant? Does she have a severe chronic illness? Does she have any bleeding disorder? Going back to the severe or chronic illness, that may or may not be given a mark, given we've already kind of covered some of the history here. Does she identify as Aboriginal or Torres Strait Islander? Does she have a bleeding disorder? Does she not have a functioning spleen? Is she planning a pregnancy or anticipating parenthood? Is she a parent, grandparent or carer of an infant under 6 months of age? Does she live with someone who has a disease that lowers immunity? Is she planning travel, and does she have an occupation or lifestyle factor for which vaccination may be needed? Discuss with the immunisation provider. So, we've got some excellent answers in here. So, and this ties into have you been unwell recently? Are you pregnant? Have you had an allergic reaction before? And yes, I have to admit I had an evil little grin when I started putting this question together because these are the things that we should be checking every time, admittedly, and often we have the checklist where the patient can just check the boxes as they come into the clinic. But these are the things we should be keeping in the back of our mind. So again, any anaphylaxis to flu vaccine ingredients, fantastic. Febrile illness, are you well? Would be fantastic. Any bleeding disorders, consent to uploading records onto a... Ooh, that is not on here, but I can almost guarantee that would give you a mark if you put it in the actual exam and on any anticoagulants. So very well done there. When was the last influenza vaccine given? And you could actually specify that out to when was the last vaccine you had given, because that kind of hedges bets and covers a few of these things all in one. Any allergic reaction to a past flu vaccine? Fantastic. Any live vaccines in the last 4 weeks? Fantastic. Any current fever? Well done. So yes, this is one of those questions that can trip you out a little bit, and it seems very kind of simple when you think about it, and then when you kind of get to 3 or 4 and you start to think, oh, wait, bother. What are the extra things I could be putting? This is where having a read through of some of the RACGP publications, including, I know we don't have much time left, but just have a flick through the handy guidebook. Pardon me, it's on the RACG website. It is an absolute plethora of information for, in fact, pretty much any what is non-pharmacological management type questions come from there, but tucked into there as well, you'll find stuff like this, the little gems that we often kind of forget to hold on to, forget to really study, and I think they sometimes look at these kinds of questions to kind of make sure we're paying attention to the things we are doing every single day.